While schools remain open in Europe, some leaders across the U.S. are weighing if in-person learning is worth the risk during a pandemic. The situation depends largely on where you live and the spread within that community. Just 11 days after New York City's public schools closed, Mayor Bill de Blasio announced the nation's largest school district will reopen next week. Meanwhile, Kentucky's Attorney General says he will take the remote learning issue to the Supreme Court after the governor signed an executive order banning in-person learning. So, is the closure of schools getting politicized, or is there scientific evidence to justify it? According to a Fox News op-ed by former CDC Director Dr. Richard Besser, who is a pediatrician and parent, right, science is not indicating schools should close, saying in-person learning has worked remarkably well when strict protocols are followed and schools have the resources they need. Dr. Besser joins me now. He's also the president and CEO of the Robert Wood Johnson Foundation, which focuses on health. Dr. Besser, welcome. Thank you for being with us. In your op-ed, you say students in classrooms may not be as at high risk for COVID as many parents fear. What precisely do we know about the risks school-age children face?
Yeah, Tanya, when I think back to the summer and conversations around should schools open in the fall, I was really skeptical that you could open schools safely. But one of the things about a pandemic or other new emerging infection is you learn as you go. And what we've learned is that many schools have been able to open very safely for children, for staff, and teachers. They've needed resources to be able to do that. They've needed to hire staff to do screening, staff to do cleaning. Many have had to retrofit classrooms so that the airflow was good. But in many schools, it's been successful. And New York City was a great case in point. Here you have the nation's largest school system was able to open quite effectively. They had to shut down because of agreements in terms of what kind of community level disease would trigger a change in what they did in schools. But what they saw was when there was a 3% positive rate in the community, which led to the closure, the rate in schools was 0.2%, very, very low. I was talking to a health director in another state. I sit on a regional council, and what she pointed out is that for many children, being in school is the safest place to be. You have someone who's watching to say, wear your mask, someone who's watching to help keep children socially distanced 6 feet apart. And as a pediatrician and a parent, I know in terms of children's social, emotional development, in terms of their cognitive development, how important it is to be in school. You have to follow the data, though. And in school systems where there has been transmission and they haven't been able to do it safely, then, of course, clearly you don't want those schools to continue. But for the schools that have been able to do this, you don't want it to become politicized. You don't want it to be a knee-jerk reaction of, oh, cases are going up around the nation. That means we necessarily have to close the schools. Dr. Fauci said it over the weekend, close the bars and keep the schools open. Take that European approach. Right. That's only going to work, though, if Congress steps up and provides small businesses with the resources that they need so that we're not pitting schools against small businesses.
Right. As a parent, I'm absolutely thrilled that, my son's school has been able to manage the situation. They are still at school in person, and I couldn't be happier for them and for myself, frankly. But I recognize that that's because the school has very strict protocols in place. The infection rate is nil. And so you're saying that this really is a case-by-case basis. Is that right? Depending on your community, depending on your particular school. What's a parent to do if they feel the situation in their area is getting politicized?
Well, it is really challenging. And the reason I wrote that op-ed is I was seeing a lot of pressure on governors, on elected officials to close schools when public health was saying not so fast. You may not need to do that. Mm-hmm. It's really important, though, that we make sure that teachers and staff who are at greater risk than children for severe disease, that they have the protections that they need. that Congress is putting forward more resources to states so that they can provide them to schools so they can continue to do the retrofitting. It's one thing to have a school in the summer or early fall where you can keep the windows open, but as it gets colder and you have to close those, what are you going to do about airflow? Have you been able to retrofit so that's a safe thing as well? But this is one of those situations where you don't need to see the closure of schools as a necessity in places where it's been done effectively. For so many parents,
Right.
it's such a value to have their kids in school. For working parents, in particular for working women, there's real value there.
Absolutely. I can attest to that personally. But I'm just curious also, Dr. Besser, what is the science telling us now? What is the latest research telling us about how much spread is happening through children? I mean, we know they tend to be, when they get it, they tend to be asymptomatic or have fewer symptoms. So are we sensing that they are able to spread it pretty easily to adults, or is there still not a lot of evidence of that?
Well, it's with influenza, with the flu, we know that children are really effective spreaders, and that's why there's such a push around children with the flu. If you look back to the 1918 pandemic, school systems that closed early, they saw less pressure and community transmission. It's appearing that COVID is different. Children can spread this for sure, but they're not the big driver in community transmission. I think that one of the biggest drivers here is that people are being forced to go to work even if they're not feeling well. You know, with the supports from Congress in terms of unemployment support, sick leave, medical leave, protection from eviction and foreclosure, those things have gone away. Those early checks are long gone. Those are distant memory. And if we want to see people being able to do the right thing, it's about more than saying wear masks, keep apart, and wash your hands. It's about giving people the resources that they need to do the right thing. And in America today, the disproportionate impact on Black Americans, Latino Americans, and Native Americans, a lot of that, I think, has to do with the resources that are not being provided to people so that they can protect themselves, their families, and their communities.
Absolutely. Well, Dr. Richard Besser, thank you so much for joining us. We really appreciate your time.
Thank you. It's good to see you again.